We now want to consider how we're going to treat and manage pain. And the first group of things I want to talk about is that we need to treat the patient as an individual. Carry out an individualised pain assessment with the patient, not on the patient. And we need to give them psychological support to minimise their anxiety and to minimise their expectation of pain. As we've already said, this can reduce pain. We believe the patient as well. We want to take away the anticipation of pain, take away the anxiety about pain. Now, anxiety and stress can increase the amounts of pain. And one of the main causes of anxiety and stress is when I become anxious and stressed when I feel I'm not in control. And it's the same for our patients. If they perceive they have lost control, their pain will be worse. So if they're dependent on my good grace coming round and giving them a pill for their pain, they depend on me, not on themselves. This is why self-medication such as patient-controlled analgesia is so good for pain. And again, there's been studies done on this. Patients can actually have less pain if they give their own analgesia with a patient-controlled analgesia machine. They can actually have less pain on lower doses of analgesics because they are in control. And they know that if they have a pain, they can press the button and that can give them 1 milligram of morphine or whatever it's set to. They're in control. So you, as the clinician, must always give up control. You give up control, you pass the control over to your patient. Now that's not very good for your ego, but we don't want egotistical nurses and doctors. We want caring clinicians who will give away the control, who will give away their power, give it to their patients. And at the same time, you can give them some psychological diversion, as we've talked about. So treating the patient as the individual, giving them the control, that's the first thing I wanted to say.